डिजिटल वर्क
डिजिटल This is for students, and others who want to join, who want to be present. YouTube.
Hello.
So might they connect through YouTube.
कोई फैकल्टी यहाँ से कोई फैकल्टी में नहीं यहाँ पे
मैडम से आइडिया था
Affiliation, affiliation.
हाँ
એમને co-host બનાવવા પડે સાથે.
બરાબર અને
બાકી
અત્યારે
બધા આપડા
તો આપણે જો માઇક ચેક કરી લઈએ આપણે બરાબર ચાલે છે કે નહીં
હા
તો સામે આપણે ફેકલ્ટીમાં છે કોઈ અહીંયા
હા છે આ બધા છે આ કારલા ફેકલ્ટી છે
તો કોઈ એકને
મારા મેડમ ને સુંદરીવા શેમને કોલ કરી કહી દો કોને કર્યો તમે ધારા મેડમ
કઈ તાન્યા આ લખ્યું છે
ધાન્યા
તો એમને આપણો વોઇસ સંભળાય છે કે નહીં
હા શું આપડા સાહેબ બેઠા છે સાહેબ ચાલુ કરો ને તમને સંભળાય કે નથી
हाँ आयो बात
હેલો 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 છોડો તમને સંભળાય છે તમે જો હા દુલ્લે સર કરો ને દુલ્લે સર આપડા મુકુંદ નીચે નીચે સર હા બોલા
मैं यूट्यूब पर
हेलो सर आवाज आ रही है कि नहीं जूम पे आप एक बार चेक करो ना नहीं सर आप ज्वाइन हुए ना अभी unmute कीजिए हाँ I will join. I will join.
पोस्ट बनाए यहाँ से
यही होस्ट
गुड आफ्टरनून सर सर एक बार जूम पे आप कनेक्ट हुए ना आपको एडमिट किया है आप एक बार देखिए ना आवाज आ रही है या नहीं आपको जूम पे ठीक है हाँ हेलो 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 गुड आफ्टरनून हेलो गुड आफ्टरनून हेलो वाइब्रेट हो रहा है ये अच्छा से देख ठीक है वॉइस वाइब्रेट हो रहा है हाँ मतलब वी नीड टू
एक मिनट
दिस वॉल्यूम इक्वलाइज
ये रोड वाली बात
હવે બોલો ને એટલે ખબર પડે સંભળાય છે કે નહીં
हेलो गुड आफ्टरनून ऑल एम आई ऑडिबल हेलो I'm good at it. You see that? But it's not audible here now. No, I listen from here. That is true, but here this should be audible now. This room. Our room आवाज बंद થઈ ગયો ને
કોઈક બહારથી બોલે ને તો વધારે ખબર પડશે
હા પણ આ રૂમમાં બી તો સંભળાવવું જોઈએ ને આપણે
હા એ જ ચેક કરું છું મેં એટલે
आवाज आ रहा है तो ऑडिबल है
बट यहाँ नहीं आ रहा है Hello. Hello, it's from there. Sir, unmute. Volume.
हाँ बोल तो बाजू वाला क्लास में ले लो
हमारा तो ये होती है
स्पीकर में नहीं आवाज आती होगी।
हाँ ऐसा ना
ये लैपटॉप को कनेक्ट करो ना, फिर उसमें हटा दो लैपटॉप।
नहीं प्रॉब्लम क्या हो रहा है कि बाहर से बोल रहे हैं ना तो ये यहाँ पे नहीं आ रहा
एक्स्ट्रा आईडी पासवर्ड से अपने क्लास में अटैच हो
डेमो
तीनों क्लास में सेटिंग है, दो जगह हो गए, एक जगह बाकी सब आईडी सिर्फ आईडी पासवर्ड से बस नहीं पता एक मतलब तो रॉन्ग कलर में आपकी। हाँ ये यार सेटअप कर पहले प्रोजेक्टर सब बहुत चेक करा। हाँ बेटा है अपने अपने क्लास में नहीं कर सकते, तो हमारा क्लास चेंज किया बाकी है तो से क्लासरूम को किया।
Welcome to the music world of SS Bright.
4.7
Mode.
Hello, good afternoon. Rabia, can you hear me?
वीडियो से ऑन
अभी बोलो मैम।
हेलो am I audible ma'am Hello?
Yes, yes, you are audible, Rabia.
Okay, thank you, ma'am. It's very loud.
તો અમને આપણે એડ કરીને
હવે બધાને એડ કરી દઈએ, સ્ટાર્ટ કરીએ. Ma'am, you want the thing, na? The cover portion. To display. Okay, that's fine. આજે અપીલ સર છે ને A very good afternoon to one and all, respected dignitaries, esteemed speaker, faculty members, and my dear students. On behalf of the Department of Shalyatantra, Sumandeep Ayurved Medical College and Hospital, Sumandeep Vidyapeeth deemed to be University Vadodara, I take immense pleasure in welcoming you all to this national webinar on Marma Chikitsa, anatomical correlation, mechanism, and therapeutic insight. I also extend a very warm welcome to our distinguished guest speaker, Dr. Apil M. Alex, and Dr. Gaurav Phul, who has graciously joined us today to share their knowledge and experience. The objective of today's webinar is to foster collaboration, share academic knowledge, and integrate theoretical correlation of MARMA with clinical practice, truly bridging tradition and innovation. Before we begin, let me acknowledge the leadership and support of Dr. Aparna Deshpande ma'am, in charge, principal and chairperson of this session, Dr. Mukund Dule sir, HOD, Shalyatantra Department and organizing secretary. Their efforts have made this gathering possible today. One against, I, Dr. Rabia Sheikh, Associate Professor, Department of Shalyatantra, on behalf of Sumandeep Ayurved Medical College and Hospital, and our in-charge principal, Dr. Aparna Deshpande ma'am, wholeheartedly welcome all our 350 plus registered participants today. Thank you. The theme of today's webinar, Marma Chikitsa, Insights, Innovation, and Clinical Application, beautifully captured Ayurvedic living wisdom. Marma are vital energy points, described as seat of prana. While injury to them can cause serious harm, their mindful stimulation through Marma Chikitsa unlocks immense healing potentially. Today, the ancient science is being rediscovered worldwide as a safe, non-invasive therapy for pain relief, spot injury, neurological issues, and holistical well-being. It truly bridges classical knowledge with modern clinical relevance. Since most of the today's audience are our undergraduate students, the topic holds special value for you. Learning Marma is not just theory. It sharpens your anatomical understanding, bridges strong clinical skills, and give you practical tools for pain management and preventive care. Now, let us move on this first presentation. It is my privilege to introduce Dr. Apil M. Alex, our distinguished speaker today. He is currently Assistant Professor, Department of Rachna Sharir, Government Ayurved College, Pariyaram, Kerala. Sir has a total of 10 years of experience in academics, a first rank holder in BMS from Kannur University, and recipient of prestigious awards like the Kotakal Arya Vaidya Shala Centered Award and the Himalaya Jivak Award. With over a decade of technical teaching experience, Dr. Alex has made remarkable contribution through paper presentation, research publication, and academic sessions across national and international platforms. Today, he will be enlightened us with his topic, Anatomical Insight into Marma Chikitsa. Ladies and gentlemen, please join me in welcoming Dr. Apil M. Alex.
Thank you, ma'am. Am I audible?
Yes. Hello. Yes, sir, you are audible.
Okay. Thank you for your warm welcome, madam. Anyway, first of all, I would like to thank you, the organizers, for giving me an opportunity to present my views regarding the anatomical insights into Marma Chikitsa. Let us start the session. I'll share my screen. Whether my screen is visible?
Yes, sir, it's visible.
Okay, thank you. Then we will start, as we are short of time, we will start continuously directly into the topic. So we will just analyze the definitions of Marma. As you know, while describing the definition of Marma, Susratacharya has mentioned that Marmani Mamsa Sira Snayu Asti Sandhi Sannipadaha Teshu Swabhavadeva Visheshena Pranaha Tishtanti. So I would like to highlight the point prana. What is prana? In the context, Acharya is mentioning that prana agniyadeha. So what is agniyadeha? Agni, somo, vayu, and sattva rajas tamaha, panchendriyani, bhudatma iti pranaha. So prana is the place. It is not a simple vital energy spot, but where all our means the gunas of the Agni, Soma, Vayu, Sattva, Raja, and Tama, all these are located in a point where in the human body that can be identified as the Marma point, which is mentioned as Marmani, Mamsa Siradi Samsridani. And the last point which I would like to highlight is Marana Karitvat Marmaha or Marana Sadrisha Dukkha Daitvat Marmaha. So it can cause death or it can cause a Marana Sadrisha Dukkha. As you all know, while describing the Roga, it is mentioned as Dukkha Samyogo Vyadayaha. So Dukkha Samyoga is Vyadi. As we all know that the injury to a Marma can cause either death or death-like deformities or Marana Sadrisha Dukkha or a pain. That pain can be a Sharirika pain or a Manasika pain. So when we are going across the definitions of the Marma, Acharya is mentioning that Vishamam Spandanam Etra Pidite Rukcha Marmatat. Here I would like to highlight 2 points, that is, these Marma Lashana should be understood based on 2 Lashana. That is, when the Sira Damanyadi Marma are injured, there will be Vishama Spandana. And when the Mamsadija Marma are injured, that will result in means Ruk. So Ruk as well as Vishamam Spandanam is the Lashana of Marma. So we are coming across the definition of the Marma. Mamsa Asti Snayu Damani Sira Sandhi Samagamaha Syad Marmedija Senatra Sudaram Jindam Stidam. So all these places, Acharya is highlighting the importance of Marma as the Samnipada, Samslesho, Atyanta Misri Bhava Idi Yabat. So we have to understand that Mamsa Peshi Samagamaho Masagarma, Astinam Samagamo Astimarmaha, Snayunam Samagamo Snayumarmaha, Damininam Samagamo Daminimarmaha, Sirana Samagamo Siramarmaha, and Sandina Samagamo Sandhimarmedi. So when we closely or critically analyze the Marma, lastly Acharya is mentioning that Soma Marita Tejamsi, Reja Sattu Tamamsicha, Marmasu Prayashah Pumsam Budatma Cha Avadishtate. So here I would like to tell you one thing, one important point regarding that. The Soma, Maruta and Tejas are nothing but the Vada Pitta Kapha. As you all know, the basic concept of Ayurveda lies in the Tridosha theory. So Soma, Maruta and Tejas are nothing but the Vada Pitta Kapha. Raja, Sattva, Raja and Tamas are also the Manasiga Gunas. So here the concept of Guna comes into application, where the Soma, Maruta and Tejas, as you all know, when we come across the definition of Vayu, that is Tatra Rusho Legu Shita Kara Sushma Chalo Anila means they are the mixing of a group of gunas. So guna, as you know, what is guna? Guna is nothing but the karma karana shakti, or means that the power to do or the capacity to do work is called energy. That energy itself is the guna. So the energy points or the guna points are located in the marma. My point is that vada pitta kapha along with the manasika gunas, that is sattva raja and tama, are located in the marma point. So while we are describing the means a simple point of marma, there we have to understand the location of the Vada Pitta Kapha as well as the three gunas, that is Sattva Raja Tamas. So Soma Marita Tejas are nothing but the Vada Pitta Kapha. I would like to highlight the point that the Vada Pitta Kapha are the group of gunas. Group of gunas can do certain function in certain cells, certain functions in certain descriptive areas. So the point that we will discuss about we have discussed about the definition of marma. Then coming to the critical review on the classification of marma. As we have already studied the regional classification and the Shadanga marma, Tesham, Egadasham, Egasmi, that is according to the Shaga Marma, Koshtagada Marma, Prishtagada Marma, and Grivam Pratyurta Marma. This is the regional classification. No need of much more explanation in the regional classification in relation to the when the treatment point is mentioned. But the structural classification, this is important in the anatomical point of view. Saptotaram Marmashadam Tani Marmani Panjatmakani Baundi. Mamsa Marmam, Sira marmam, Snayu marmam, Asti marma, and Sandhi marma. The structural classification is important in case of an anatomical point of view. Then next is the classification of marma based on injury or aghata. This is also important while describing about the Shalya Chikitsa. So these 2 points I will highlight in my presentation. That is the classification of marma based on the structure as the classification of marma based on the injury or the aghata. As you know, the classification of marma based on aghata, that is the Sadhya Pranahara, Kalandara Pranahara, Vishalekhanam, Vaigalyakara, and Rujagara. And this Sadhya Pranahara marma, while describing, Acharya is mentioning that it is Agneyani. So the Agni Guna is the predominant. As you know, then Agni Guna is having the property, concept of Guna comes into means picture here. Rucha Tishnoshna Vishada, Sushma Rupa Gunodbanam, Agneyam. So that marma, the marma which is mentioned as the Sadhya Pranahara marma, there will be Agni Guna Bhuishta. So Rucha Tishnoshna Vishada, Sushma Rupa Gunodbanam, that is the property of Agneya. And Dreva Shida Guru Snigdha Manda Sandra Rasodbanam, Apiam, that is the property of Apiam. Then Vayavyam Rucha Vishada Legu Sparsha Gunodbanam. That is, these 3 properties should be coming into consideration. So we will critically analyze the Samanya Marma with the Lashana. When we come across the Mamsa Marma, I would like to tell you Vidya Ajastra Mastrik Fravo Mamsa Davanavatanu Pandutvam Indriya Jnanam Maranam Cha Ashu Mamsaje. When a muscle fiber, so this Mamsa Marma can be considered as the muscle tissue only or the muscle fiber only. When a muscle fiber is injured, symptoms such as pain, swelling, bruising, and tenderness can occur, along with the muscle weakness and impaired mobility depending on the severity of the tear. So that is the Lashana of the Samanya Marma with the Lashana of the Mamsa Marma. When we come to the Asti Marma, it is Majjanido Acho Vichinaha Sravo Rukcha Asti Marmani. When a bone is injured, the body initiates an immediate healing process that is different. That includes the inflammation, a protective blood clot, and the formation of new blood cells to the close to the fracture. And when we come across the Snayu Marma, the Samanya Marma with the Lashana is Ayama Akshepaka Stambha, Snavaje Abhyadigam Ruja, Yana Stanasana Shakti Vaigalya Matava Andagaha. So here I would like to highlight one point that Snayu Marma is not just a tendon injury. It is not a tendinous injury. Snayu in the context of Marma can be directly related to the nervous tissue injury. Why I am telling you? Because when we are coming across the description of the Snayu, Acharya is mentioning that Nahi astini nava peshyo nacha sandeha na vyapadini tadahanyu yada ayu sharirana. In our human body, the structure which you injured, it causes an excess defect. That is nothing but the snayu. Ayama, Ashepaka, Stamba. All these are convulsive disorders. This is nothing but, and another, while explaining the snayu, Acharya is mentioning that snayu riti shanakaraha. Or the Navasna, the Kashyapacharya has very well clearly mentioned that the Navasnayu Shadani Mastulunga Mulani is mentioned. Mastulunga is nothing but our brain. So that Mastulunga Mula. So in the context of Snayu Marma, Snayu is nothing but our nervous tissue. That is the reason why Yeh Snayu Pravijadani Bahyascha Abhyandarastada Sagudam Shalyamahartum Deha Shaknodi Dehinam. The external as well as the internal Snayu, if a surgeon knows well, or the external or the superficial nerves as well as the deep nerves, if a surgeon knows well, he can easily extract the foreign bodies. That is the reason why he is telling that, Acharya is mentioning that Ehasnayu Pravijadani Bahyascha Abhyandarastata Sagudam Shalyamahartum Deha Shaknodi Dehina. So coming to the Siddhamarma. Siddhamarma Vede Sandra Ajasram Bahusriksraved Tadishayad Tridu Brahma Shwasa Moha Hidma Birandaha. These are nothing but the blood vessels only. So blood vessels comes under the heading of these veins as well as the arteries. Then Santimarma Vastu Shukhe Rivakirna Dudecha Kuniganchada Bella Chesta Shekha Shoshaha Parva Shobascha Sandiche. So you will experience the symptoms such as pain, stiffness, swelling, tenderness, and the reduced flexibility. So my point is, even though we are telling that the depending upon the structure, there are 5 types of marma, or according to Ashtanga Hridaya, it is 6 type of marma depending upon the structure. Prana ayatana samanya, because of the normalcy that the prana ayatana, because of the seat of the location or the location of the prana, the marma is only one type. And Acharya is mentioning that Chaturvidayastu Sira Sharire Prayena ta marmasu sannivishta. While explaining the Sira, Acharya has already mentioned that the 4 types of Sira, Vadavaha, Pittavaha, Sleshmavaha, and Rektavaha Siras, they are present or they are related closely to the marma. And this classification is based on the Angula Pramana. As you know, the marmas are divided into the Pramana or the Angula Pramana or the dimension of the marma, which is mentioned as half Angula Pramana, 1 Angula Pramana, 2 Angula Pramana, 3 Angula Pramana, and 4 Angula Pramana. These Pramana classification, these to understand the, we should not injure to the point whenever there is a surgical procedure we are doing. Then that is the reason why marmani shalya vishayartham udaharanti. These marma, those who are extracting the foreign body or those who are dealing with the shalyatantra point of view, they have to understand the marma point. And why that is the reason. What is the definition of shalya? Mana sharira abhadakarani shalyani. Acharya is mentioned that cheda bheda abhigadabhyo Dehana Dharanadapi Ubhagadam Vijaniyat Marmanam Tulya. So whenever we are doing any the Ashtaveda Shastra Karma mentioned in our class, that is Chedyam, Bedyam, Legyam, Bedyam, Esha Mahari Misravin Svidyam, the Ashtaveda Shastra Karma mentioned in our classics, while we are doing that, we have to be very careful to the marma points also. And this is the point I would like to highlight. The marma.
Interrupt, sir. Sir, can you make it a full screen?
Sorry, just a minute. Can you see now, ma'am?
Yes, sir. Thank you.
Okay. So sorry, I was.
Continue. Sorry for the interruption.
Sorry. So, sorry, I was not knowing that it was not full screen. Just I have started. Thank you. Anyway, sorry, madam. So look at the point, that is the marma bhigada in the present scenario. Whenever we are describing about the marma bhigada, we are describing only about the physical cause. We are directly hitting by a road traffic accident only. But the marma bhigada in the present scenario should be understood under the heading of the Aghantu Karana. I would like to highlight the Aghantu Karana mentioned by Acharyas. Ye Bhuda Visha Vayu Agni Kshada Bhanghadi Sambhoha Raga Dvesha Bayadescha Te Suragadavo Gadaha. So in the present scenario, Ye Bhudas are nothing but Charagacharya is very well clearly mentioned that Bhudaha sa Vishakrimi Vishajadeha. Bhudaha sa Vishakrimi Vishajadeha. So my point in the today's presentation, one of the important point is in the present scenario, Marmabhigada should be understood under the Aghantu Karana. All the Aghantu Karana which are mentioned in the class 6 should be understood in the heading of the Marmabhigada, because Ye Bhuda Visha Vayu Agni Sheda Bhankadi Sambhoha, the thermal injury, that means the road traffic accident or any injury by the firearms or any injury can cause Marmabhigada. So in the present scenario, Ye Bhuda Visha Vayu Agni Sheda Bhankadi Sambhoha Raga Dvesha Bayadesha. That is the reason you look how holistically Acharya is mentioning the Raga, Dvesha, Bhaya, etc. All these are causing an injury to the marma. That is the reason Mana Sharira Abhadagarani Shalyani Acharya is mentioning. So the Aghantu Karana, so the diseases which are mentioning in the context of marma abhigada, in the present scenario, we have to understand under the heading of Ye Bhuda Visha Vayu Agni Shada Bhanghadi Sambhavaha Raga Dvesha Bayadesya Tesu Ragandavogadaha. So not only a physical injury, but also the injury from the Bhuda, Visha, Vayu, Agni, all these should be understood under the heading of Aghantu Karana. Then So that is the reason Acharya is mentioning that marmanyadishtaya hi ye vikara murchanti kaye vivida naranam prayena te krichratama bhavanti narasya etnairapi sadhyamana. So we have to understand the marma bhigada under the heading of the agandu karana, and that is the reason marmanyadishtaya hi ye vigara. Whenever a disease is related to marma, that will result in severe problems to the patient, so that we should address the patient. So the coming to our topic, a critical analysis on the anatomy of marma. These two topics, a critical the structural classification as well as the classification based on injury, we will discuss under the two heading. One is structural classification, another is the marma and cell injury. The farming to the first classification, because the structure is important. As you all know, when we come across any human body, there are means the cellular level organization is there, tissue level organization is there, organ level organization is there, organ system is there, the organ. So we will discuss the tissue level organization of the marma, because as you all know, the broad classification of the marma or the tissues is epithelial tissue, connective tissue, muscular tissue, and nervous tissue. All the marma, the structural classification of marma, whether it is a mamsa marma, sira marma, snayu marma, asti marma, or a sandhi marma, all these comes under the heading of these four tissues. So when we are discussing about the epithelial tissue, I will come across the concept of kala and srodhas in Ayurveda. When we come across the connective tissue, the sira marma, asti marma, and sandhi marma should be addressed, because Sira marma is included there, asti marma is included, and the sandhi marma is included under the heading of the connective tissue. These are my views. So when we see the epithelial tissue, it covers the body surfaces and lines the hollow organs, body cavities, and ducts. It forms glands. These are nothing but the concept of kala and the srodhas. When we come across kala, kala khalyobi sapta bhavanti dhatu ashayantara maryada, or the limiting membrane or the limitation between a dhatu and ashay is kala. That is the reason when we come across the vascular endothelium, which is the lining between the vascular vessel, blood vessel, and the blood. So that is a kala, that is the Raktadara kala. So when we come across the kala as well as the srodhas, as you know, it is nothing but the sravana srodhamsi. Not only something is flowing, but something is oozing out, or it is having a property of secretion. That is the reason the epithelial tissue which cover the body surface and ducts, and also form the glands, which is having a secretory portion, is considered under the heading of epithelial tissue. And in connective tissue under the sira marma, asti marma, and the sandhi marma, the muscle tissue, it generates the physical force needed to make the body structure move. That is the reason the mamsa marma is included there. Talahridaya indrabasti gudasthana rohidani mamsa marmani. When we are mentioning about the mamsa marma, we have to understand the muscle tissue, which are the type of tissue. That is the muscle tissue, whether it is a striated muscle or smooth muscle or a cardiac muscle. So the muscle tissues or the mamsa marma are included under the means modern anatomical purview of muscle tissue. And when we come across the nervous tissue, it detects the changes in a variety of conditions inside and outside the body. How beautifully it is mentioned. Look at this. That is the reason why yahasnayu pravijadani bahyasya abhyantarastada. The bahya and the abhyantara snayu, if he is knowing, if a surgeon is knowing, sagudam shalyamahartum, that means if it is a deep rooted shalya, he can extract the foreign body. That is nothing but the snayu marma. So the snayu marma, ani vidaba kakshadara kurcha shira vasti shipra amsa vidura utshevaha snayu marmani. All these snayu marma can be included under the heading of a nervous tissue. When we come across, as I have already told you, the epithelial tissue, this consists of cells arranged in continuous sheets, either single or multiple layers. These are not so important, but the function, the second last point which I would like to highlight is, it is having the function of protection, it is having the function of filtration, it It is having the property of secretion. It is having the property of absorption and excretion. So this is nothing but the function of a Srotas as well as Kala. So the Srotas as well as Kala, why I have included here, because when we are discussing about a typical type of tissues, epithelial tissue is not included, you will ask. So epithelial tissue can be considered under the heading of Kala as well as Srotas, and because the Srotas is defined like that there are unicellular glands and there multicellular glands are there. Then coming to the connective tissue, this is very, very important, because the marma which are mentioned in our class 6, that is Siramarma, Astimarma and Sandhimarma, these included under the heading of the connective tissues. And the cells which are included in the connective, as you all studied about the connective tissue, they bind together, support and strengthen other body tissues. That is the function of these connective tissues. That is the reason why if a astimarma, if a sandhimarma, if a means siramarma is injured, that will result in the defects to other organs or the other parts of the human body, and it protect and insulate the internal organs. It serves as a major transport system within the body, because as you know, blood is a liquid, means fluid connective tissue, because what happens when a siramarma is injured? Sandra majasram bahusraksraved means when a siramarma is injured, that will result in excess loss of blood. That is the reason Acharya is mentioning that when a siramarma is injured, excess loss of blood. That is the reason Rekta is mentioned. Rekta, Dehasya Rudra Moolam, Rudrena Darede, Tasmad Etnena Samrishyam, Rektam Jiva Idistiri. Sutracharya is very well mentioning the importance of Rekta. That is Dehasya Rudra Moolam, Rudrena Darede, Tasmad Etnena Samrishyam, Rektam Jiva Idistiri. So it is the main source of immune response also. And the point we have to remember here is connective tissue consists of extracellular matrix and cells. So what are the cells which are included in the connective tissue? What is the extracellular matrix? And these extracellular matrix are protein fibers and the ground substance. And these cellular fibers are secreted by the extracellular fibers are secreted by the connective tissue cells itself. So when whichever cells are injured, that will result in its corresponding injury. For example, when we are telling about the connective tissue cells, there are fibroblast cells are there, macrophages are there, then plasma cells are there, mast cells are there, adipocytes are there, white blood cells are there. So when any marma, so look at this, that is when which cell is injured, depending upon that, the injury will be that. When a fibroblast is injured, that will not be same as that of an injury to a plasma cell. So marma abhigata should be understood in a microanatomical level, when which cell is involved or the which cell is injured, what function it has impaired, or what is the function of that cell. So fibroblast cell, macrophages, plasma cells and the mast cells, all these, as you know, mast cells are abundant along the blood side vessels that supply the connective tissue. They produce histamine, a chemical that dilates the small blood vessels as a part of inflammatory response. As you know, when we correlate the inflammatory response to the Ayurvedic classics, it is nothing but the Daha Paga, etc. That is the Acharya is mentioning that Vadadrde Nasti Ruja, Na Pagaha Pittadrde, Nasti Kabaja Poyaha. So Vada, it is the pain is because of Vada. Vadadrde Nasti Ruja, Na Pagaha Pittadrde, the inflammation or the suppuration. Whenever there is there, that means it is the Na Pagaha Pittadrde, Nasti Kabaja Poyaha. Whenever there is kaba only, it will result in pus. So the point is the mast cells or the inflammatory response should be understood based on the dosha concept. Then adipocytes or the fat cells, whenever it is injured. So the injury to an adipose tissue or an adipose cell, it will result in certain defects that is not related to, but that cannot be correlated to a fibroblast injury. So the point is, whichever cells are injured in the marmabhigada, that cells function will be impaired. And the ground substance, which is the ground substance which is impaired, whether it is a collagen fiber, whether it is an elastic fiber or a reticular fiber is injured, that will result in respective problems of the marmabhigada. And this, as you know, the collagen fibers are strong and resist the pulling forces. Then collagen fibers are found in most type of connective tissue, especially in bone, cartilage, tendon, and the ligaments. So in case of a marma bhigada, which is related to asthi-marma or a sandhi-marma, these collagen fibers as well as the cells which are related to that will be injured. So in that context, we have to understand what is the injury in the collagen fibers present, because it is strong and it resists the pulling forces. That is the reason when an asthi-marma or a sandhi-marma is injured, that will result in certain problem related to the cells which are injured, or the fibers or the collagen fibers which are injured. And the elastic fibers, as you know, these elastic fibers has the property, because they are plentiful in blood vessel walls and lungs. Whenever the elastic fibers are injured, then elasticity will be lost, because it can be stretched to 150% of their life without breaking. So reticular fibers, and these reticular fibers are produced by fibroblasts. As you know, when the the fibroblast cells are injured in a marma bhigada, it will result in the reticular fiber production, and reticular connective tissue which forms a stroma of the supporting framework of many soft organs such as spleen and the lymph nodes. So in due course of time, when the marma is injured, this results in the defect of the fibers as well as the cells. So these are the classification of the connective tissue, which can be broadly classified into embryonic connective tissue and mature connective tissue. And our heading will come under this cartilage, bone, blood tissue, and the lymph. So coming to the muscle tissue, that about the means connective tissue, where we can include the siramarma, asthi-marma, and the sandhi-marma. Coming to the muscle tissue, where the mamsa marma we can incorporate, it consists of elongated cells called muscle fibers that can use ATP to generate force. The muscle tissue produces movements, it maintains the posture and generates heat. As you know, whenever a muscle means whenever a mamsa marma is injured, that will result in certain postural defects, or depending upon its site of injury, whether it is a skeletal muscle or a cardiac muscle. In the microanatomical point of view, we have to understand, or we have to analyze that whether it is a skeletal muscle part, whether it is a cardiac muscle part, whether it is a smooth muscle part. If the smooth muscle is injured, that means injury or the result, the effect will be different. If a skeletal muscle is injured, the effect will be different, as you know, because the smooth muscles are located in the walls of hollow internal organs such as blood vessels, airways to the lungs, the stomach, intestines, gallbladder, urinary bladder, etc. So there the smooth muscle injury, what is the problem of the smooth muscle injury? When the smooth muscle is injured, it will result in injury to that. Coming to the nervous tissue. So I have already told you, in the context of marma, we have to understand that the snayu marma should be considered as a nervous tissue, because nava snayu shadani Acharya Kashyapa is very precise that Nava Snayu Shadani, there are 900 snayus in the human body, which is having a Moolasthana in the Mastulunga or the brain. So, and also Snayu, Eha Snayu Pravijadani, Bahyascha Abhindarastada, Sagudam Shalyamahartum, Deha Shaknodi Dehina. So it is not an external or a tendon or a ligament. It should be understood under the heading of snayu. That is the reason why the nahi astini nama peshyo na sandeha na astini na ja sandeha vyapadini tada hanyu yada snayu sharirina. When Acharya is mentioning about the snayu, the injury to a snayu is much important, because injury to a snayu, it cannot be compared to the injury to any other structure in the human body. So it can be considered under the snayu marma. Consists of two types of cells, neurons and the neuroglia, because neurons or the nerve cells are sensitive to various stimuli. They convert these stimuli to nerve impulses and conduct these impulses to other neurons, to muscle tissue or the glands. So this nervous tissue should be understand, it has a role with the other neurons, it has a role with the muscle tissue, it has a role with the secretion of the glands. So when the snayu marmas are injured, that will result in injury to the corresponding structure. My second point is, first of all, we have discussed about the structural classification of marma. So based on the structural classification of marma, I am not going deep into the each and every marma mentioned in Ayurvedic classics, because that is the thing which is mentioned in classics. You can easily study that. But these are the things or the highlights which I would like to tell. Means these are the extra thing I would like to tell to you, the listeners, because when we are looking at the modern anatomical point of view, the structure, whether it can be, so for example, we are explaining about the palmar aponeurosis. So that palmar aponeurosis, when the palmar aponeurosis is injured, the very well it is mentioned in modern classics, modern science. It is mentioned that when it is injured, what it will happen. Like that, each and every marma should be analyzed based on the structure or the tissue level of organizations. That is the one point I would like to highlight here. And the second one is marma abhigata and cell injury. This is very, very important, because when we are describing the marma under the heading of the structural classification, that is Sadhya Pranahara Marma, Kalandara Pranahara Marma, Vishalyakana Marma, Vaigalyakara Marma, and Ruchagara Marma, this Marma Abhigata and cell injury comes into picture. So I have told you, Marma Abhigata in the present scenario should not be understood in a physical injury only. Ye Bhuda, all the Agundu Karana, Ye Bhuda Visha Vayu Agni Shada Bangadi Sambhava, Kama Krodha Bayadeshchate Suragadavo Vedaha. So all the Agundu Karana should be incorporated into the Marma Abhigata. So whenever we are describing the pathology of a cell injury or pathology of a disease, cell injury comes into picture. That cell injury, there are two main causes. One is genetic causes, and there is acquired causes. Genetic causes, we cannot do anything, because in the Marma Abhigata context also, genetic causes, it is incurable. That is the reason Acharya has mentioned that in the context of Prameha, Charagacharya is very precise that Jada Pramehi Madhumehino Vanna Sadhyukta Sahi Bija Dosha Ejapi Kejit Kulaja Vigara Bhavanti Tamstan Pravadandi Asadhyan. In the context of Arshas also, Acharya is mentioning that Asadhyaneva Makhyada Sarva Roga Kulodhava. When a disease is congenital or when a disease is having a genetic predisposition, it is asadhya. Asadhyaneva makhyada sarva roga kulodbhava. Next is jata pramehi madhumehinova na sadhyukta sahi bija dosha. It is because of the bija dosha. So in case of a cell injury, genetic cause, we cannot do anything. If it is an acquired cause, we have some role. That acquired causes comes under the hypoxia and ischemia, the physical agents, chemical agents and drugs, microbial agents, immunological agents, nutritional derangements, and the psychological factors. All these are the Agandu Karana, which I have mentioned already. The Ayurvedic classics, which has mentioned the Agandu Karana, is nothing but the acquired causes of a cell injury. The physical agents, which comes under are mechanical trauma, thermal trauma, electricity, radiation, and the rapid changes in atmospheric pressure. All these are resulting in the Marma Abhigata or Marma injury. And the cell injury is basically reversible and irreversible. That is the reason when a Marma or a cell is injured, it can be reversible or irreversible cell injury. The reversible cell injury is there, irreversible cell injury is there. Irreversible cell injury is cell death. That is the results in. Then in case of reversible cell injury, there are certain modifications, certain adaptations in the cell. So we will discuss one by one. That is, what is the pathogenesis of a cell injury? If a cell is, so my point is that Marma Abhigata should be understood based on the cell injury, whether it is a reversible cell injury or a irreversible cell injury. So coming to the pathogenesis of the cell injury, what is the type, duration, and the severity of the injurious agent? So this depends upon the type of the status of the adaptability of the target cell. That also comes into picture. Then underlying the intracellular phenomenon, inability to reverse the mitochondrial dysfunction by reperfusion or reoxygenation, disturbance in the membrane function, plasma membrane in particular. Then morphological consequences. This is the pathogenesis of, finally, all forms of biochemical changes underlying the cell injury are expressed in terms of morphological changes. The interruption of blood supply, as you all know, when a marma is injured, that is the reason Chaturvida, the Ajari has already told that Chaturvidayastu Sira Sharire, Prayanata Marmasu Sannivishta, the interruption of the blood supply or ischemia and impaired oxygen supplied to the tissues, hypoxia, are the most common form of cell injury in human beings. So this is the point is very important, that the interruption of the blood supply, ischemia, and impaired oxygen supplied to the tissues, hypoxia, are the most common form of cell injury in human beings. That is nothing but Chaturvidayastu Sirasharire Prayanata Marmasu Sannivishta, means Snayasti Mamsani Tadeva Sandhin Sandarpya Deham Pradipalayanti. So the 4 types of sira mentioned in Ayurvedic classics are located in marma, or whenever there is a marma injury, whenever there is a cell injury, it will result either ischemia or hypoxia. So look at the reversible. What is the, in case of pathogenesis of the ischemic and hypoxic injury, the reversible cell injury, 2 process will happen: decreased generation of cellular ATP and reduced intracellular pH. The decreased generation of cellular ATP is nothing but the functional derangement, and reduced intracellular pH, it will result in acidosis. So next is reduced protein synthesis, functional consequences, ultrastructural changes. These are the microanatomical level changes when a cell is injured. Look at the first point, reduced protein synthesis. As a result of continuous hypoxia, ribosomes are detached from the granular endoplasmic reticulum and the polysomes are degraded to monosomes, thus causing reduced protein synthesis. So as a result of this reduced protein synthesis, the functional derangement will be there. So look at that, means functional consequences. Myocardial contractibility ceases within 60 seconds of coronary occlusion. That is the reason it is a Sadhya Pranahara Marma. If it is a Sadhya Pranahara Marma, the myocardial contractility ceases within 60 seconds of coronary occlusion, but can be reversed if the circulation is restored. So that is the reason. So we are mentioning the functional consequences of the marma. Then coming to the irreversible cell injury, the irreversible cell changes in structure and function. When we are discussing about the irreversible cell injury, there is a point where the stage at which the no return to the normalcy is possible. So that there are 2 important phenomena occurs there: inability of the cell to reverse the mitochondrial dysfunction and disturbance in cell membrane function. That is very, very important. Look at that. In case of irreversible cell injury, disturbance in cell membrane function or the plasma membrane function. As you all know that there is the Srodo Dushti, that is Etra Sankhaka Vaigunyat Vyadis Tatrobhajayate. Whenever there is a Gha Vaigunya or a Srodo Dushti, there that will result in disease. How beautifully Acharya has mentioned. Look, Etra Sankhaka Gha Vaigunyat Vyadis Tatrobhajayate. Disturbance in the cell membrane function. When we critically analyze that, this cell membrane function can be of 4 types. That is Adipravarti, Sankhova, Sirana, Grendyo, Viva, Vimargadova, Vigramanam, Sodasam, Dushtilashanam. So Adipravarti, Sangha, Siragrandi, or means Vimargagamana, all these are the consequences of the disturbance in cell membrane function. So we have to critically analyze if it is an irreversible cell injury, whether there is a Srododushti is there. So the marma, sroda, scala, all these concepts are not different. They should be incorporated together. In addition, there is continued depletion of proteins, leakage of lysosomal enzymes, and reduced intracellular pH and a further reduction in ATP. There is functional derangement is there. And the serum estimation, that is in case of cardiac troponins we are using, in case of certain cardiac injury, whether so based on that we can incorporate the marma abhigada also, whether that marma abhigada is severe. When it means the marma abhigada, if it is severe, means that it can result in death or myocardial infarction. That means if the troponin level we can analyze by the blood levels. So these are the morphology of cell injury. So the point I would like to highlight is if it is a reversible cell injury, there will be degenerations. The name is given older as the degeneration. Irreversible cell injury, cell death, necrosis, complete means death of the cell. Programmed cell death, apoptosis, residual effects of cell injury. As a result of the certain cell injury, there are certain residual effects, or something is behind, or something is lying behind. That is called, otherwise called subcellular alterations. The cell will do certain thing to maintain its normal function. So that is called subcellular alterations, or to change to overcome that stress, cell will do certain things. Deranged cell metabolism, intracellular accumulation of lipid, protein, and carbohydrate, after effects of necrosis. All these are the mechanism or the morphology of cell injury. So we have to understand, depending upon the effect of the cell injury, it can be an irreversible or a reversible cell injury. And in certain cases, there will be intracellular accumulation will be there. So accumulation of substances in abnormal amounts can occur in the cytoplasm or nucleus of the cell. Look at the concept of AMA comes here. Not only an external injury, I have told you, because look, accumulation of substance in abnormal amounts. That is the reason Amam, the concept of Ama. Ushmano alpa balatvena dadu madhyam apachitam dushtam amashengradam rasamamam. That ama is nothing but the accumulation or the visha within the cell. Accumulation of constituents of normal cell metabolism products in excess. Then abnormal substance. Then accumulation of pigments. All these are the after effects of the cell injury in intracellular accumulations. Then morphology of irreversible in case of cell death, that can be autolysis, necrosis, or apoptosis, and the result that is the autolysis. As you know, it is the self-digestion, the disintegration of the cell by its own hydrolytic enzymes. Then it is the autolysis is slow in case of fibrous tissue. Look at this. Then autolysis is rapid in some tissues which are such as pancreas and gastric mucosa. Autolysis is rapid because the cell death is or self-digestion is rapid. That is, it is intermediate in tissues like heart, liver, kidney, etc. Because they can adapt. Then autolysis is slow in fibrous tissue. That is the reason Sadhya Pranaharata, Kalandara Pranaharata, all these differ. So the point I would highlight is the Sadhya Pranahara Marma, Kalandara Pranahara Marma, Vishalagna Marma, Rujagara Marma, and Vaikalagara Marma should be understood based on the cell injury. Then coming to the necrosis, and cell will be coagulatory necrosis and liquefaction necrosis is there. The cell digestion by the lytic enzymes and denaturation of the protein, that is the protein, the structure of the proteins will be entirely changed. And in case of gaseous necrosis is present in case of TB infection. Then fibrinoid necrosis, the last point is, it is a degeneration characterized by the deposition of fibrin-like material in the hypertension and all. That is a chronic long-standing hypertension and all. There will be fibrinoid necrosis will be there. Then coming to the apoptosis or the falling off or the dropping off, it is the coordinated and internally programmed death. It will not come across in the marma bigada. It is the life of that cell is completed. So as a result, the cell will means apoptosis, the programmed cell death. So coming to the gangrene, necrosis of the tissue with the superadded putrefaction. That can be dry gangrene, wet gangrene, and gas gangrene. This will come across in the context of the injury to the marma, because dry gangrene, it begins in the distal part of the limb due to ischemia or TOS, arteriosclerosis. Then wet gangrene, most of moist tissues, diabetic foot, bed sore. So in long-standing cases of certain diseases, this can result in wet gangrene. So that is the reason Kalandra Pranahara Marma, certain marma should be understood that it is not only the external injury, but also the diseases which are causing to the marma point also should be understood. Marma nyadishtaya hi e vikara, murchanti kaye vivida narana, prayanata kritsradama. So that should be understood as it is very difficult. Prayanata kritsradama, bhavanti atneirabi sadhyamanaha. Then gas gangrene, it is formed by Clostridia bacterium. So this is also comes under at the olden time. This gas gangrene was also prevalent because at the time the war wounds was common, and that war wounds will result in certain marmabhigada, and that complication is one of the complication is gas gangrene, because the antiseptic measures were not that much prevalent or that much excellent at the time. So the entry into the open contaminated wounds, especially in muscles, so that will result in coagulative necrosis with the liquefaction. So coming to the cellular adaptation, this is the final point. Thus, in case of cellular adaptation, when a cell is injured, there are certain, for the sake of the survival on exposure to stress, the cells make certain adjustment with the changes in their environment to the physiological needs and to non-lethal pathologic means injury. These are nothing but the atrophy, hypertrophy, hyperplasia, metaplasia, and dysplasia. So these cellular alterations results in the means as a result of cell injury, as a result of marmabhigada, the after effect will be either any one of these. Either can, if it is a reversible cell injury, that there are certain cellular adaptations will be there. That cellular adaptation should be included under the atrophy, that is hypertrophy, hyperplasia, metaplasia, and dysplasia. Then the point is atrophy, reduction of the number and size of parenchymal cells of an organ or its parts which was once normal. As a result of the injury, the number and size of the cells of an organ or its parts will be reduced. That is atrophy. That physiological atrophy is there, pathological atrophy is there. Developmentally small size is hyperplasia. Extreme failure of the development is aplasia. So the atrophy as a result of cell injury, reduction in the number and size of parenchymal cells. So that can result in that is the after effect of a cell injury. Then these are the starvation atrophy, ischemic atrophy, disuse atrophy. So look at the third point, disuse atrophy, that is prolonged diminished functional activity, there is muscle wasting. So I would like to tell you, just 5 minutes, I will complete within 5 minutes, disuse atrophy. And in the disuse atrophy, when a muscle fiber, for example, in the means when a muscle is injured, muscle wasting, when a means marma is injured, that will result in disuse atrophy. We are not at all using the changes. So the hypertrophy is the increase in size of parenchymal cells, results in enlargement of the organ or tissue without any change in number of cells. And hyperplasia is the increase in the number of parenchymal cells resulting in enlargement of the organ or the tissue. Then next is metaplasia, is the transformation or the reversible change of one type of cell to another type of adult cell, usually in response to abnormal stimuli. Then last is dysplasia, and the disordered cellular development often accompanied with the metaplasia and hyperplasia. So these are the cellular adaptations. So my point is, whenever a marma is injured, depending upon the injury to the marma, whether it can be Sadhya Pranahara, Kalandara Pranahara, Vishalagna, Vaigalegara, or Ruchagara, these should be understood based on cell injury. So let me conclude. The point is the structural classification. Marma is not just a mere surface anatomical landmark. The structural classification of the marma should be understood based on the tissue level of organization, and the classification of marma based on injury should be analyzed by understanding the cell injury, and the marma abhigada should be understood based on the gunahani or the karma karana shakti hinada. So that is my point. These are my points of the anatomical insights to the marma. The structural classification should be understood based on tissue level. The injury or the aghata should be understood based on cell injury, Either it can be a irreversible cell injury or a reversible cell injury. And the marma abhigata also should be understood based on the gunahani on the karma karana shakti hinada, because as already mentioned, Soma Marita Tejamsi, Buddhatma Chavadishti. So, as I have told you, Vata Pitta Kapha, Sattva Rajatama, and the Buddhatma are located in Marma. So, the Karma Hinada or the Guna Hani should be understood. So, the treatment should be based on that. And not only an external injury, but all the, sorry, all the Agantu Nidana, which are mentioned in our class 6, that is A Bhuda Visha Vayu Agni Kshata Bankadi Sambhava, Rakadvesha Bayadesha Tersura, all the Agantu Karana or the Agantu Lashana should be incorporated in the Marma Abhigata. So that is the Marma Abhigata in the present scenario. So let me conclude. Thank you. Thank you for your patient listening. Thank you.
Thank you, sir, for that insightful session. Your presentation beautifully connected the structural and functional significance of MRMA with clinical applicability. I'm sure our students now have a better understanding of this concept. The session is now open for the discussion. Student with question can ask through the WhatsApp group, and participants in this meeting can ask question via meeting chat. The session is open for the discussion. The session is open for the discussion. You can ask your queries through this meeting chat and also to the WhatsApp group.
Namaste, sir.
Namaste.
I want to ask one question, sir. Are there
Tell me,
spec-
madam.
are there specific dissection-based studies or imaging techniques that can enhance the anatomical teaching of marmas?
No, that means in my point of view, the marma are the means Acharya has mentioned the marma as a surface landmark or a surface marking in the means in the context. When we mark the marma in the surface point, there what is located deep to that what is there, that is our analyzing. But the section wise, if we are taking, for example, the pramana of a marma, for example, if it is mentioned as half angula pramana, whether it is its a circumferential diameter or a length or a breadth or its volume, that cannot be analyzed like that. So we have to understand in the olden time, marma has been mentioned as the surface marking point. So in the surface marking point, means deep to that there are that other structures are there, so that we can understand from the modern anatomy as well as there. But in the olden times, the deep structures are not mentioned like that. Deep structures, while doing the dissection, Ajay has seen that, but at the olden time, like that imaging technique was not there. So my point is the surface marking of a marma is in the skin. So based on that, we can locate the marma.
Okay, thank you, sir. I want to ask another question.
Yes.
Sir, out of 107 marma,
Yeah.
which is more applicable for clinical practice in day-to-day modern practice? Which
Yeah,
is more clinical?
Yeah, madam, the question is clear, but the point I would like to tell you that the concept of marma is two in the concept of marma chigilsa as well as the marma mentioned in Ayurvedic classics is two. Marma chigilsa means there are certain areas in the human body or the points in the human body when it is triggered or when it is triggered, it will result in the cure of certain disease. But in the context of the marma means marma sharira or the mentioned in the pratyeka marma nirdesha of the chapter of the Susra Samhita, there the marma, that point should be protected. It should not be exposed to any manipulations. So the marma chigilsa point as well as the marma mentioned in Ayurvedic classics, both are different in my point of view, because for example, in case of Kerala marma chigilsa, they are triggering certain points and that results in cure of certain diseases. But that marma as well as the Tamil marma principles which they are using, that is entirely different. That is the reason Acharya has mentioned that these marma points should be protected from Cheda, Bheda, Abhigada, etc. The Ashtavida Shastra Karma, while mentioning, the marma point should be protected only. So this point, the marma chigilsa as well as the pratyeka marma nirdesha mentioned in Ayurvedic classics, both are different. Both are different points in my context or in my point.
Thank you, sir. That was beautifully explained. Thank you so much, sir.
Thank you.
Thank you, sir. As there are no more questions, I hope our students have grasped this concept clearly. Thank you once again, sir, for your informative and engaging presentation. Thank you, sir.
Thank you, ma'am. Thank you very much. Thank you for the organizers. Let me leave the meeting, ma'am.
Yes, sir, you can leave.
I have another class. That is the reason. Thank you.
Yes, sir. Thank you.
Thank you.
Now, moving ahead to our next esteemed speaker, it is my honor to introduce Dr. Gaurav Phul, sir. He is currently Deputy Medical Superintendent at CBPACS New Delhi, a topper in his PG Eastern examination. Dr. Phul pursued his MS and PhD in Shalyatantra. His illustrious career include authorizing 5 books, multiple research publications, and serving as a peer reviewer for prestigious journals. He has been a pioneer in establishing a dedicated Marma Chikitsa and pain management clinic at CBPACS in 2016. Recipients of multiple awards such as the Vaidya Chandra Prakash Award, Sutra Excellence Award, and Best Book Author Award, Dr. Phul is widely recognized for his expertise in marma therapy, spot injury, and integrated pain management. Today, he will present on the thought-provoking theme From Classics to Clinic, Marma Chikitsa in Contemporary Practice. Let's extend a warm welcome to Dr. Gaurav Phul, sir. Welcome you, sir. You can share your screen.
Okay. Thank you so much, ma'am. Am I audible?
Yes, sir, you're audible. Sir, can you extend the screen? Can you make it full screen?
Yes, sir. Is it now visualized? Visible, ma'am?
Yes, sir, it's visible.
Okay. So, first of all, thank you so much for inviting me on this prestigious webinar. I wholeheartedly thanks all the Sumandeep faculty and especially Professor Mukund who happened to be my PhD guide also. So the topic assigned to me is today is clinical aspects of pharmacy. Okay. So am I properly audible? Okay. Hello. Is it audible?
Yes, sir, it's audible.
Okay. So Ma'am, it will be convenient to talk in English or Hindi or mixed.
Sir, whichever is convenient for you,
Okay.
both Hindi.
People understand Hindi over there, na?
Yes, sir. We have participants from all over India, so whichever is convenient for you, you can share it with us.
Okay, sure, sure. So I'll start with my presentation. I'll be talking about Maram Chikitsa. I'm postgraduate in PhD in Chalde Tantra. That's why I'll talk about the clinical aspects of Maram Chikitsa. The session just before me was very interactive and very insightful, I should say. I just want to have a different opinion on one thing, that is the Chikitsa point of view. As sir told that it has been told to protect the Maram points and not to injure them with any kind of injury, blunt or sharp weapon, anything. I just want to quote here is that Maram Chikitsa is not injuring the Maram points. It is the stimulation, sensitive stimulation of the Maram points. I will be covering in this aspect. And as far as the text is concerned, there are references of Chikitsa in the text in just bits and bits manners. Full-fledged Chikitsa perspective is not available in the text, that's right. So I'll be trying to cover it all. So first of all, I would like to share the tweet from a very renowned personality or a global personality. That is, we should not be afraid of Vedic education, because Vedic knowledge is at the cutting edge of science, spirituality, and medicine, and studying it would take we out of the arrogance and superficiality. So we must study the Vedic education with open hands, open brains, and open arms. So basically, I won't touch much of the anatomical aspect as it has already been covered. But important is they are the one points are the important identifiable parts of our anatomy and reflect key physiological and psychological processes that occur. They are the key connecting points to all our aspects of our energy, from innermost consciousness to the outermost physical organs. This is very, very important, because basically one points are connecting windows, or you can say the energy points which connect the inner conscious to the outer body. So they are the vehicle to reach the inner conscious of the patient, or subconscious mind, or you can say the subtle body of the patient. So definition sir has covered. Marmanina Masiras Snayuasti Sandhi Sandipataha Keshu Subhata Esha Prana Tishtanti. The second line is very, very important, that Subhavta Visheshen Prana Tishtanti. So they are the seat of prana. So basically they are the energetic centers where life flows, accumulates or flows. Thus, treating the Marm points is more a means of treating prana rather than simply working on the physical tissues or organs. This needs to be understood very well. And this is the exact definition of Marm Chikitsa. This has been derived by me only. So it has been quoted in our book. I have authored 2 books on Marm Chikitsa, and this has been quoted in one of them. So it goes like Upcharatmik दृष्ट्या शरीरस्य निर्दिष्टानानां यथा कालं यथा विधं च प्रेरणं मर्म चिकित्सा इति अभिधीयते. So it can be defined as the technique to stimulate the specific vital points of our body in a certain way at a critical moment of time for purpose of healing. So basically, for the purpose of healing, when we stimulate the merm points, it becomes a merm chickitsa. Then I come to that aspect what the expert before me was talking about, that is Manantiti Marmani, Acharya Dharana has put it. And this is the reason many Ayurvedic doctors still fear of stimulating the merm points. But it's not like that. I would like to quote a reference from Rasatan Samuchya, which is regarding the use of wish. Matraya bhakshitam devi visham api amritayate matra adhikam vararohe hi amritam hi visham bhave. So what is written in it is that if poison is used in minimum quantity, it is useful like a nectar. And if more quantity is used, it's better. Similarly, we do Agni Karam. What we do is we literally burn the patient. So that can cause the dug also, burn injuries. But still, we use Agni as a therapeutic procedure, and that yield wonderful and quick results. So what is the harm in stimulating the burn points? Similarly, it depends upon the pressure, basically intensity of the pressure. If the quantum of pressure is just in a controlled way, and the clinician is well acknowledging the amount of pressure to be applied, then the MERM points yield very, very good results and very quick results. And they are one of the best Ayurvedic interventions in management of musculoskeletal pain. So we should not be afraid of using the MERM points in the Chikitsa point of view. Plus, it is an ancient Indian practice whose focus is manipulation of subtle prana, subtle energy, that is prana in the body, for purpose of supporting the healing process. Basically, we stimulate the MERM points and it supports the healing process of the body. It encourages the healing of the body. So, MERM points are vehicles to reach the ultimate goal of Ayurveda, that is perfect health, firmly rooted in a vibrantly alive body and fully awakened mind. And importance of Maram Chikitsa, Acharya Sushruta has quoted as Marmani Shalya Vishayardham Udaharanti Sushruta Charisthana Dhyache. Basically, any surgeon, if he wants to operate on the human body or wants to do any procedure, any kind of procedure, he must be having the knowledge of Maram body. So basically, this is regarding the Maram Vishaya, basically Maram science. So this is the half of the Shalya Vishaya. So this is that much important. So marmas are of utmost importance, as any forceful trauma on them may cause death or deformity. Thus, they are designated as important as any other surgical practice. Half of the success of surgery depends upon knowledge of complications. And they are very important tool to reach the principle, to achieve the principle of Ayurvedic medicine, that is Jnana Buddhi Pradipin Yona Vishti Tattavit Atarasya Antaratmanam Na Sarva Chikita. Ayurveda reckons that a good clinician should try to read the soul or subtle body of the patient. That is, to read the subconscious mind of the patient to treat him properly. The empathetic and positive gestures and affectionate touch by a compassionate clinician can bring about positive changes in physiological processes and trigger the healing mechanism of the body. This helps in self-defense from ailments and negative energies. This basically principle is very, very important, which basically differentiates the Indian system of medicine from the Western system of medicine. We treat the human being as such, not only the disease. That's why this is very important to reach the subconscious mind of the patient. And MERM points help us in achieving that goal. As far as history is concerned, MERM points are the knowledge of MERM is very, very deep and very ancient. The Vedas are the, we can say, oldest literature known to the mankind. So, firstly, in the Rig Veda, there are a reference of MERM points. It is called as Varman or Drapi. Basically, body armors were called as Varman and Drapi, and there were a lot of wars at that time. So, to protect the MERM points, the body armors were in Atharved. There is a reference that MERM points should be protected from arrowhead injuries. In Mahabharata and then Ramayana, there are references of the MERM points. I would like to quote one or two very famous examples, like when Bhim killed Duryodhan, he hit the thigh of the Duryodhan, and there is the Urvi MERM in the thigh, and it is a Kalantar Pranam, and it has been quoted in the text that Duryodhan basically suffered for 48 hours or so, and then died with the blood loss. So that is what is written in MERM text. That Urvi MERM and Marmaghat causes a Raksarav, and then subsequently it is fatal for the patient. And then in Ramayana, when Sri Ram was not able to kill the Ravan, then Vibhishan told that prana of Ravan are in the Nabhi. Nabhi is a Satya prana. And when Bhagwan Ram hit Ravan on the Nabhi, he was killed. So likewise, there are many references of the MERM science, and later on, Acharya Sushruta created a chapter on the MERM Sharir and elaborated the different aspects of the MERM. They were on according to those structure, location, Marmaghat, Mahabhut. There are different classifications. I won't touch them because they have been followed. So according to those, we can do different stimulation of different MERM points for achieving the homeostasis of different doses, Vata, Pitta, and Kapha, and then subsequently their 5 times. Then according to structure, as I told, Acharya Bhagwat has added one more in in addition to what Sushruta has. So I would like to quote a good example here that Budh Marm is quoted as a Dhamni Marm by Acharya Bhagwat, whereas it is a Mas Marm by Acharya Sushruta. So why there is this much difference? Because Sushruta mentioned more about the anatomical aspect, because there is a sphincter complex over there, so it is a Mas Marm. But Bhagwat mentioned about the basically clinical aspect more. So there is a very good amount of blood circulation in the anorectal region, and any injury may create the basically blood loss, extensive blood loss, and then patient may die. And sphincter complex, as far as is concerned, both is a Sadhya Prana hormone, mind you. So there are two reflexes in the body. One is rectocardiac reflex. If any intervention on the anorectal region without proper anesthesia is done, it may stimulate the cardiac vessels and muscle fibers, and it may result into sudden cardiac arrest. So that's why both is a Satya Prana hormone. Another reflex is Brewer-Lippard reflex. Again, if there is improper stimulation of the anorectal region without using the proper anesthesia, then it may cause the laryngospasm and cardiac arrest. So again, it becomes a Sadhya Prana hormone. So basically, there are different classification according to Harmadahat, and here I would like to quote another example of Rujakar Prana hormone. Basically, Rujakar Prana hormone are 8 in number. Basically, 3 Marmani are Rujakar, Gulf, Manibandh, and Kurste. Because they are multiple in number, the count becomes 8. So I would like to quote example of Gulf. If anyone suffers from ankle sprains sometime, so it heals at that time by the management, but later on, whenever there is excessive winter or excessive standing by the patient, it again causes the pain. So that's why it is quoted as a Ruja Karma. So this classification is very, very meaningful. Then most important classification for a clinician is clinical, according to the site. So marm points are 107 number, but they can be more, as any sensitive point on the body is a potential marm, as quoted by Acharya. So distribution of Marmani in the body according to clinical sites is 11 in each limb. They become total 44 in the limbs. Abdomen and chest are 12 marm points. Back 14 marm points, and in supraclavicular region there are 37 marm points. So these are the pictorial depiction. I would just pass it on. This is the depiction of marm points. We have tried to incorporate the 3 different classifications in one picture. So basically, you can see on the left bottom side, there are color coding, and on the right bottom side, there is the size of the dots. This show the Ardh Angul Praman, Ek Angul Praman, Dvay Angul Praman, Trey Angul Praman, and Pani. So this is according to the dimension of the marm box. So you can see in the picture that location is depicted with the dots, but the size of dots is different. You can see a big ball in the navel region, or basically the suprapubic region. So these are the panital size of marm points like Vasti, Nabhi, Hridaya. They are larger marm points. And accordingly, the smaller marm points are shown with the smaller dots, and color coding suggests the structure of the marm point. That is, whether it is a mass marm, Sira marm, Sandhi marm, or spine. So this is the classification. Likewise on the back side. Then Marmani of upper limb. I would actually, I would just quote, there are 11 marm points in the upper limb as told in the classification. They are just like Manibandh, Hridaya, Kushtir, then Indravasti, Purpar, Thani, Urvi, Lantaksh, and Kakshta. So they are located at different points, but because this session I won't be able to cover all of them, I would just give a few of the examples. Like Shipramarm, you can see in the right side picture that Shipramarm is located in the web of the thumb and index finger, and Manibandh is located on the wrist joint. So wrist joint overall is a marm point, or Rujakar marm, but whenever injury happens, it causes the pain, chest pain. And when we stimulate it for the therapeutic purpose, it is in line with the middle finger on the extensor retinaculum, that is dorsum of the wrist as well as ventral side of the wrist. So flexor and extensor retinaculum in line with the middle finger, just at the base, is the location of merm point to be stimulated. Likewise, thalhidem is in the center of palm, and it can be stimulated for the therapeutic purpose. And similar 11 merm points are in the lower limb. The only difference is in place of Manibandh, there becomes the Gulf marm, that is the ankle joint, and in place of the Gurpar marm, there is Janu marm, that is knee joint, and in place of Kakshidhar marm, there is a Vitap marm, that is inguinal canal. Rest all the marm points are similar in number and almost locations are also similar, but because the lower limbs are heavier in size, the location becomes different. And when we talk about front side of the body, that is abdomen and the chest, there are 12 more points. They are both Nabi, Stambul, Stamboli, Tapla, Papstam, Vasti, and Shakti. And when we talk about back side of the marm points, they are 14 in number, but basically they are 7 only. And because they are in groups, they become 14. So 14 marm on the back are 2 ones, 2 ones for Yati, Parsha, Shakti, Nitam, Kukundara, and Katika. These are the supraclavicular region marm. They are 37 in number as such, but there are 13 marm points which are in multiple numbers and become. So 2 Manya and Dila, Matrika, 8 Matrika, Trikartika, Vedot, Pan, Apang, Avar, Shank, Utshep, Sapani, Simant, Trikartika, and Adipati. So these are the different marm points. I would like to quote the example of Sapani. Sapani marm is also known as the third eye of Shiva. So basically, it is a very, very powerful marm because we all know we also perform Shirodhara over there. When somebody hypnotizes someone, this marm point is used. Whenever we try to focus on something, this marm is very, very important. And study shows that this marm is directly direct impact on the pineal gland as well as the hypothalamus, and that's why it is very, very important for reducing sleep, reducing stress, reducing hypertension. So this marm is very, very powerful. Naturally, whenever we are not able to remember something, what we do is we unintentionally take our thumb or little finger over the Sapni marm, and we just try to focus on it. So this is the nature's way of telling us that this is the marm where you should try to concentrate for good memory and for relieving the stress. And in Indian mythology, there are traditionally the females wear bindi over here, males put on the tilak, and that's why to keep the mind cool and to keep the stuff in control. So this is very important. And likewise, Adipati marm is on the top of the vault, and in Hindu mythology, it is believed that when the body is burnt, there is a Kapal Kriya in which the Adipati is hit by a log of wood or bamboo stick, and it is believed that when it is broken, the prana exits the body. So, and Adipati is known as master of the body, and it controls the Sahasrara chakra. So basically, it controls all the chakras of the body. So these are the supraclavicular marmani pictorial disease. So now we come to most important thing, that is the clinical aspect, methods of marm therapy. How can we stimulate the marm points? So there are basically broadly 2 kinds of classifications. One is pharmacological and one is non-pharmacological. Actually, I have made it like in this way for having a better understanding. Because pharmacological means whenever we use some kind of medicines to stimulate the marm points, like abhyangam, we use certain kind of oils to massage over the marm points. Vartan, aromatherapy, local applications like lay, parishek, and dhara. Herbal treatments may be local or oral. Like there is reference of marm gutika and dabu marm gutika in Shastriya. So these are the oral medicines to heal the injuries of the nerve points. Likewise, certain other oral medicines are given according to needs to heal the nerve points or to having the better impact on the nerve. Then there is non-pharmacological methods like pressure application, which is known as Mardan or Peden Chikitsa, pranic or energy healing, and Marmvegan healing. Although any kind of injury over the nerve point is contraindicated, but again you have to keep it in mind that we are not injuring the nerve points. We are just stimulating the nerve points, very controlled stimulation, and it gives us the wonderful results. Okay, so the pressure application is very controlled, and you have to keep it in mind whenever we talk about the trauma. Then Acharya Sushruta has quoted Patan Pidan Prahar Mrig Dasham Pravritti. So basically, any fall, trauma, any injury, forceful injury, or any animal bite, that are quoted as injuries. Okay, so when we talk about Bhagan or Asti Bhagan or basically Asti Sandhi Bhagan, then Sushruta has told that what kind of trauma is required to injure. So basically, these are the classifications methods of punishment. So first of all, the Abhyang. We all know the Abhyang is a well-known therapy in Ayurveda, but to achieve the basically the target of stimulating the Marm points or doing the Marm Chikitsa, we can do it in a generalized Abhyang, means Sarvang Abhyang, and then we come to the individual Marm points. Otherwise, a regional Abhyang like Sthanik Abhyang means, for example, there is a problem in muscle spasm over the back. So all the back is massaged. Abhyang is done over the back, and then the specific Marm points are massaged. And last is the localized. In the OPD setup, we can directly stimulate the Marm points with the local massage. Udvardhan is another well-known technique. De-stressing and relaxing the Marm points, remove excess fructose, and strengthen the body and helps in reducing pain. Then there comes aromatherapy. Aromatherapy is again a different therapy, but basically we use like abhyangam, snedara, snake pichu, steam inhalation, etc. Then the brain function. So basically, aromatic oils are very beneficial because they have more the properties like sucham, and they have a better penetration inside the body. So basically, the snake pichu over Marm points, it stimulates the Marm points very fast. And in case of an injury, it enhances the healing process. Before going for any farming, we just on the safer side, we don't apply pressure or massage over the Marm point. We simply put on the lip. Lip chikitsa is done. For example, if patient comes with a knee swollen, effusion of the knee, we just apply the lip over it just to reduce the swelling and to heal the Marm point. And accordingly, then we go for the proper diagnosis and accordingly decide what kind of stimulation is required. Similarly, parishek can be done, dhara can be done. For example, the patient is of pediatric age group, so we cannot apply the pressure over there, or sometimes we are not able to do the forceful massage. So we can do the simple snake or snake dhara over the movement. Or in the geriatric patient also, or the patients are having lower circle or lower threshold to the pain, can do the any of these. Then herbal treatment, as I have told, either the local treatment or the oral medicine. Then non-pharmacological methods like pressure application I talked about, because the other two require more understanding of them. So pressure application, what we can do is we can apply a controlled pressure. The pressure should be firm enough and bearable for the patient. Means it should not be too light, it should be firm enough, but it should not be too hard to bear because Marm points are tender points. always tender points. Some merm points are very tender, some are relatively less tender. And whenever there is some pathology, there will be increased tenderness over the merm points. There was a study conducted at Jamnagar, I think, and in which the tenderness over the Indravasti merm was examined as a diagnostic tool to understand the intensity of sciatica. So, I mean to say is, whenever you touch the mark point of a disease patient or who is suffering from any kind of disease, the particular mark point become more tender. So basically, intervascular becomes more tender in cases of the urogenital disorders or the vascular disorders of the lower limb. It becomes more tender. Likewise, other mark points. So basically, the pressure should be firm enough and bearable for the patient. And we can adopt one of the two methods. One is apply the pressure for 0.8 seconds, release it, then again reapply the pressure, release it. So we do it for 18 to 25 times in one sitting, and we can conduct 2 to 3 sittings in a day. Why 0.8 seconds? Because cardiac cycle is of 0.8 seconds, and it has been told that seat of pran. So we can do the basically we can follow the cardiac cycle. Or another method is we can follow the breathing pattern. Means whenever patient exhales, we have to apply the pressure, and when patient inhales, the pressure is released. Again, on exhalation, pressure is applied. On inhalation, pressure is released. So that can also be done to stimulate the muscle. Spiritual dimension, touch, because whenever we do the Maran Chikitsa, we touch the mark points of the patient and decide what kind of skilled touch of a sincere practitioner of the healing arts can convey its message of good health to prana into non-Buddhian. There was a study conducted which quoted that if you hug your loved one for more than 20 seconds, the positive neurotransmitters are released and stress level is reduced. So touch is very, very powerful if it can be applied in a proper way and empathetic touch. So basically, mark the junction of body with the mind. They can stimulate unconscious body processes, sensory responses, or emotional reactions. Treating them can release negative emotions and can remove mental blockages, including those of subconscious. So sometimes they are used to stimulate for the de-addiction also and to reduce the level of stress. Uses of Varm Chikitsa, it is widely used in different clinical things, in clinical conditions, like to treat the disease of nerves and brain, in traumatic, neurological or neurosurgical lesions like traumatic paraplegia, hemiplegia, monoplegia, in orthopedic lesions like PIVDs, to reduce the musculoskeletal pains of nerves, muscles, ligaments, bones, and injuries, joints, and to produce anesthesia during surgical interference. You must have heard or seen the painless tooth extraction, and no anesthesia is given and tooth is extracted without pain. So likewise, anesthesia for few moments can be achieved by stimulating the muscles. To improve the function of body organs by achieving homeostasis. Okay. And to manage or reduce the complaints related to lifestyle disorders like hypertension, diabetes, obesity, insomnia, etc. We have treated many cases of hypertension and lifestyle. So many a times we don't require medicine. The patient comes in the initial stages. So only malnutrition is sufficient. To activate the malvalve or deform the body parts or musculature, like congenital shortening of the neck and telepathic equinovarus syndrome, clubfoot. So Varm Chikitsa can be helpful to improve these. They can be used to boost immunity, rejuvenation of mind, relieve stress, and promote the meditation. This is very important because during the era of COVID-19, it was very beneficial to stimulate the certain set of burn points to reduce the stress of the patient. And whenever I see the patient in the medical setting, when we think the patient is under stress, but forgetfulness is there, memory loss, or patient is not able to recall the things very easily, or is under stress, is stressful, not able to concentrate, then the mark points play a very important role. We teach the patients confirmability and they can do it. Then pain. I have quoted it as a Marm Chikitsa Vedana Shrestha. Am I audible properly? Hello? Am I audible?
Sir, you are audible.
Sir, voice is breaking in
So
between.
pain management. Okay, voice is breaking. I think my internet connection is little unstable. Just give me a few minutes. Just a minute. Hello. Is it better now?
Yes, sir, it's better. You are audible.
Okay. So basically, I have quoted that Marm Chikitsa is Vedna Shrestha. So Marm Chikitsa is best way to pacify bath and it reduces the intensity of pain, gradually increases the pain threshold of body. It's a well-known fact that stimulation of large sensory fibers from peripheral tactile receptors can depress transmission of pain signals from brain body areas. That's written in physiology text. Basically, MERM stimulation probably induces psychogenic excitation of the central nervous system. Basically, it stimulates the nervous system at the central level, and thus the pain management is achieved. Our body is beautifully designed and it can be quoted as a universal basically lab, because there are different neurotransmitters in the body. There are chemicals like opioids are already available in the body, endorphins, opioids, all. And but the amount of their release depends upon the need of the body. So when we do the Manjitsa regularly, it probably induces the excitation of analgesia system at the central level, and therefore the pain threshold of the patient gradually increases, and pain bearing capacity is also increased, and patient is having the lesser pain in comparison to earlier. Plus, the dependence on the analgesics and anti-inflammatories reduces. So this is very potent tool to manage the musculoskeletal procedure of the body. So how we do the mammography basically? Examination of the body surface for assessment for locating the mark points is necessary, because it is impossible to give exact location because of individual differences. Some people are having good height, some are smaller in stature, some are obese, some are weak, gender differences are there. So basically, exact location cannot be defined until we do the proper examination of the body. So one has to determine the exact location of specific mark points. So I would reckon that we should learn the surface anatomy of the body. Surface anatomy is universal for all of us. Like the angle of Lewis is located at the second intercostal space for all of us. Okay. So likewise, the iliac crests are at the level of L4, L5. The inferior border of scapula is at the level of T78. So basically, these are the surface anatomical landmarks. If we remember them, we can easily locate the mark points. Or another method is like the Ungul Praman told by Sustu. Like he has given that the Ani Marm is three angul above the Urpar. Likewise, Urbi Marm is 4 angul above the Ani Marm. So likewise, we can calculate the angul praman of the patient and then locate the marm. So exact location of marm varies according to individuals depending upon the measurement of the body and body parts. Adapt the method according to need. Angul praman of the patient has to be taken, that has to be kept in, because if the angul praman will be different of means one day a male clinician is doing the stimulation, another day a female clinician is doing, or another clinician is doing, so angul praman will vary of the doctor. we have to take the Angular proman of patient always to locate his one point or any landmark on the wall. As told in our text, that Angular proman, the Angular proman of cell. I would like to share a few case studies over there related with Marvin's. This is the case the patient having the problem in brachial plexus. You can see the nerve conduction studies. On the left side is the pre-treatment study, which shows nerve conduction study suggestive of pure motor axonal involvement of the left triceps or left axillary nerve. This patient had a history of fall, had fractured scapula and ligament injuries. But when he visited us, it was already 6 months, and scapula fracture and ligament injury was healed. But there was problem in movement of the shoulder joint and pain in the limb. So patient was not able to move the shoulder joint properly. And now conduction velocity study was conducted at another hospital where he was treated. So on the very first day, we started the month. So this is the clinical findings. These are the clinical findings. Before doing the muscle stimulation, the left limb was affected. So before stimulating the muscle points, the flexion of the shoulder joint was 100 degree only, abduction was 85 degree. Although the normal range is 180 degree, range of movement of the flexion and abduction of the shoulder. So it was reduced to 185 degrees. So when we did one stimulation, immediately after the first sitting, the flexion became 130 degrees and abduction became 120. The applied stretch test was normal. Adduction and internal rotation was also normal. Then on second day, it became 140 degrees flexion, 120 degrees abduction, and after 5 sittings, the flexion and abduction became 165 degrees. There was a remarkable improvement in 5 sittings from 100 degrees to 165 degrees in terms of flexion of the shoulder joint, and 85 degrees to 165 degrees, that is double the amount in case of abduction of the shoulder. And the time span was only 11 or 12 days in between the 5 sittings. Followed the patient. After 1 month, the 180 degrees was maintained and patient was in no pain, ease of movement, range of movement both improved. And then we went for nerve conduction study again. So you can see on left side, it says normal electrophysiological study of upper limbs. That is, and right side says normal nerve conduction study in all tested nerves of the bilateral upper limb. So you can see there is a remarkable improvement in the nerve conduction study also, nerve conduction velocity, that is known as NCV. So this is the power of one. Another condition, another patient of brachial plexitis. Brachial plexitis is inflammation of the brachial plexus. It is a network of nerves that control the sensory and motor functions of upper extremities. And brachial plexitis is characterized by acute onset of motor plus sensory, loss of one or more nerves originated by the brachial plexus. There is acute onset of shoulder pain followed by weakness, sensory loss of shoulder or upper extremity. So patient visited to us with basically atrophy of the muscles around the shoulder and painful shoulder joint, reduced range of movement and reduced sensation. So NCV and EMG study of brachial plexus on the 3rd Feb 2022 showed abnormal NCV with left axillary and musculocutaneous axonal neuropathies, abnormal EMG study electromyography with ongoing active denervation without re-innervation in the above nerve distribution. So possible diagnosis was left trunk brachial plexitis. Similarly, this patient was put on one visa and the other NCV studies. Results were prior to the treatment. NCV study indicated abnormal left axillary and musculocutaneous axonal motor neuropathies accompanied by an EMG study that revealed active denervation without re-innervation. However, after receiving the treatment as of April 5, 2022, that is after the 3 months, there was marked improvement in the patient's left axillary deltoid and left musculocutaneous biceps amplitude measurements. This is a comparative analysis axillary nerve, the value before treatment was 1.6, and this is the CMAP amplitude. And after the treatment, it raised to 2.8 millivolt, and in musculotaneous nerve, it raised from 0.9 to 5.2 millivolts. So there was a remarkable improvement in the conduction velocity of the patient. And clinically, patient became symptom-free. There was no pain. Even the muscle gut was improved. This case was also published in the International Journal of Ayurvedic Medicine, that is IJAM, that is a Web of Science focus, Web of Science Index journal. It was published last year in the month of July. So there has been a lot of research work related to mantra done by different clinicians. One study I told of mine was published in IGAM last year, and another. This is my student, Dr. Varsha, did her PG from Parallel University only, and she worked on the mantra effect in primary dysmenorrhea and got very wonderful results. The clinical outcome of mantra first after a case series. It was published in 2023 again in the other papers, and blood pressure normalizing effect of Karade man therapy, a case of studies, the case study published in JAIM, Journal of Ayurveda and Integrative Medicine. Then there was another study which was on the effect of Mridu Sambhahan over Takradhara in anxiety and stress-induced essential hypertension. That is Mridu Sambhahan of the Stapni, and it was compared with the Takradhara in cases of anxiety and stress-induced essential hypertension. It gave also very good results in the Stapni. Then, interestingly, I'm a reviewer for GIM. I reviewed a paper, and it was on a comparative study on MERM and acupuncture. I was not aware that this paper was written by Chinese authors. So basically, still people in India or people in Ayurveda are questioning the basically legality of the MERM Chikitsa, and Chinese people are writing the papers on comparative effects of acupressure and MERM. So we have to think about it, that why we are behind other people globally when it comes to research and all. We don't basically have confidence on our own science. So this is a very interesting paper. You can all study it. Then another is navigating pain and clinical inquiry into manuscripts of first startup. Again, it was published. This is my paper. This is not full link actually. My PPT got misplaced somewhere, so I had to just compile it right now. So the reference is up. But you can see International Journal of Ayurvedic Medicine edition of July 2024. Sorry, it has been written as 23. And there are another studies done on manuscripts, like on frozen shoulder. There are many studies. We have recently conducted a study of 6 months on frozen shoulder patients, and very soon we'll be able to come to publish the results of that study. We have seen the effect on basically biomarkers in cases of frozen shoulder, the effect of one on biomarkers. We got very encouraging results. So I would like to conclude this with saying that to popularize the MERM therapy, it is important to observe the effect of MERM therapy in different orthopedics and neuromuscular diseases in a large scale, because when large scale studies will be conducted, people will believe us more, and our own people will have more confidence in doing the stimulation of MERM. In the present time, development of MERM therapy is harmless, cheapest, and easiest therapy end of the day. It is the best way to serve our society. Very simple to learn this medicine and surgery less option. And initially, one can learn and practice self-MERM therapy, keeping the few things required in mind. Self-MERM therapy is very potent prophylactic measure to prevent the illness. It can be learned with few simple practices and reverses. So we can teach initially what we do is we do the MERM stimulation ourselves. Then if patient requires MERM therapy for a longer time, we teach him or her the self-MERM therapy. Or it is very important to practice on ourselves also, to know about the amount of pressure and to know about the effects of MERM therapy. So we should practice the self-MERM therapy first. MERM therapy should be applied cautiously and gently in acute neurological lesions, so as to prevent the giving bad name to the or everything else. People do what the people do is they learn online techniques of Paramahansa. There is a rising trends nowadays that online lectures are conducted and people teach one therapy and all online only or through YouTube. So we are not able to get exact knowledge of the amount of pressure, exactly how to feel the burn points, and it results in basically sometimes side effects of the burn points because we have to keep in mind they are the seat of prana. So we are basically stimulating the nerve points, but we are playing with the prana of the body. And we have to keep it in mind. Marantiti Marmani, it has been quoted. So we should learn it properly and then apply on the patient. So it is always advisable to learn it physically rather than the online lectures, through online lectures. But yes, if you are curious, you have interest, you can learn online also. But basically, you should be cautious enough to apply it on the patient. First of all, you should do the self-therapy. I would like to show because we had received very good results of MERM stimulation in different camps. I was fortunate enough to be invited as a guest speaker or trainer for medical officers of different states. So this is the news of Haryana. Allopathy को challenge दे रही ऋषि मुनियों की आयुर्वेद मर्म चिकित्सा. I can be seen in the picture also. So we had very good results in a live camp and media covered that and it was a headline next day. जिसका एलोपैथी में नहीं राज मर्म चिकित्सा में उसका इलाज because again people saw it themselves. Then मर्म चिकित्सा गंभीर disease से निजात के लिए मददगार. This is the MERM therapy unit at CGPAX, my hospital. In 2016, it was established. This was the first MERM therapy, exclusive MERM therapy OPD in the northern. I was fortunate enough that health minister of that time, health minister of Delhi, inaugurated it, and I had the privilege of stimulating his mouth points also. You can see the smile on his face because he was having pain on the stimulation. So he was laughing that you are giving one pain to reduce another pain. He was having actually pain in the cervical region, and he asked me, "Can you do something to reduce it?" So I stimulated his mouth points. So this is a good memory for me. And this is my book, Clinical Approach to Manchester. It was available on Amazon for just a short time period. It has been retracted because I'm coming up with another edition of this book. So, although it is available, Clinical Approach to Manchester. Then another is Hindi version of book, Parv Vigyan ka Chikitsa Upyog. This is my YouTube channel. There I have shared a few cases of Manchester and clinical studies and MERM Shaya, another aspect of the MERM stimulation, where MERM bed is made for the patients, bedridden patients, and the patient can lie down daily on it and get the benefits of it. So the video is available on YouTube because this was a short webinar. I could not cover all the aspects. And another is my Facebook channel. It's amazing. I have a page on the Facebook. So I would like to conclude by Acharya Sushruth's quote, चिकित्सात पुण्यतमम ना किंचित अपि सुषुप्त. चिकित्सा से पुण्यतम चीज कोई भी धरती पर सुनाई नहीं देती. And divine is the task to do. So we work on the pain management and it is a divine task. We all are blessed by Lord Dhanvantari to do this divine task. So we should learn the Manu Chikitsa properly and execute it. It is a wonderful science, believe me, and you will get the wonderful results. People now are doing extensively practicing the Manu Chikitsa, and we all should do it. So for the students, I would like to quote that don't be afraid of Marantiti Marmani. Just learn it through a proper trainer, proper teacher, and then slowly apply it. You will get the wonderful results. And I have shown a few case studies to you. So I would like to quote, it is really beneficial. Just don't be afraid, just learn it and then apply it. Thank you. I would like to conclude.
Thank you, sir, for that enriching and clinically oriented presentation on Marma Chikitsa, The session is open for the discussion. Students ask your question through the WhatsApp group, and participants in this meeting can ask their questions through meeting chat. Session is open for the discussion.
Good evening, sir. Sir, we will be shortly
Very good evening.
we will be shortly coming in third year. So we need to guide us you for murmur, how to practice related to issue of murmur. So please guide us for it.
Okay, first of all, I would say that you should learn the surface anatomy as I told you, and you should learn the basically literature, available literature on the modern science, and then you should start practicing it. So you have to understand that very principle of modern science is to encourage the body to heal itself. So it's not difficult, but you have to learn under guidance. So best way is to basically first of all learn about the literary aspect and then apply the mark points, and just keep in the mind the clinical condition of the patient and do's and don'ts. For example, I can tell you few don'ts, like you should do the Maran Chikitsa ideally empty stomach or 3 hours after the meal. One thing. Secondly, whenever you practice the Maran Chikitsa, ask the patient to have the Satvik Ahar. So you just ask the patient to refrain from having non-vegetarian food or tamasic ahar in that period. And third is you should have your pranic energy good, means you should not be ill yourself, and you should be engaged with the patient. It should not be that you are just pressing the mark points, thinking about something, talking on phone and all. You should be doing the proper stimulation by getting engaged into the condition of the patient. So you should be empathetic enough because the pranic energy is directly proportional to your focus. So if you will be empathetic, will apply cautious energy on the patient, you will be able to get the wonderful results. That is said that some people had shifa in their hands. That shifa is only your empathy toward the patient. So mind it, Gyan Buddhi Pradipin Yona Vishtit Aturasya Antara or plus Ayurveda says that Palet Putra Vade Aturam Vishat. So you should be empathetic towards the patient. Plus another don't is first trimester of pregnancy you should avoid because some burn points can stimulate the basically upon vayu and maybe uterine contraction may be increased. So you should avoid. You should avoid in acute trauma if you are not sure that whether there is any fracture or dislocation or something or spinal injuries are there. So you should not give pressure on the burn points. Rather, you should go for lap or dhara chikitsa until you get confirmed that your diagnosis gets confirmed. So little don'ts you have to keep in mind. The nails should not be there. Nails are bad conductor of energy. Plus, the nails will erode the skin when you stimulate the mouth points. So little things have to be kept in mind. You can do it.
Good afternoon, Dr. It was really a wonderful session.
Good afternoon. Thank you.
Sir, please tell me the mom points for diabetes and hypertension. Except Tal Hirda ke alawa bhi, is there any mom point which we can stimulate?
Yes, for hypertension patients, a very important one point is Thapni, this one, because I told you this is a very important one point to reduce the stress, to improve the concentration, and to induce the sleep. So basically, Sthapni Marm is very, very important. Another one is the Adipati Marm. Adipati Marm you can stimulate with all the 5 fingers by the pulp of all 5 fingers like this, and then Tal Hriday Marm of the left side only. Because when we stimulate the left side marm point of Tal Hriday, then we can achieve the reduction in the heart rate as well as blood pressure. But when we stimulate the right side, the heart rate and blood pressure will increase. And when there is a variation of the blood pressure, like sometimes it reduces, sometimes it elevates, then we have to do both sides. Otherwise, in elevated blood pressure, we should use the left side. left side Talhirde of upper limb as well as lower limb, Khapri and Adipati, all of them. And there is another maneuver in the Marm Chikitsa that can't be told right now, that can be learned. And as far as diabetes is concerned, the very important one point is Indravasti. Indravasti of upper limb is very important. Kurpar is very important in managing the diabetes cases. And Vastima. These three are to be added along with Sapni is also important. So you can do practice.
Thank you, Doctor. Thank you.
Namaste, sir. I want to ask you one question. What areas of Parma Chikitsa need more research to gain wider global acceptance?
Pardon? Can you please repeat the question?
Okay. What areas of Marma Chikitsa need more research to gain wider global acceptance?
Ma'am, I think first of all, we should believe in Marm Chikitsa and then do research on the clinical aspects. Like we have tried to research on the frozen shoulder cases, a case series of 30 patients, and we have studied the biomarkers. So I think the studies focusing more on the clinical aspect rather than the theoretical aspect, and having the clinical trials, larger clinical trials with proper objective parameters can establish the Marm Chikitsa in the as far as research is concerned globally. I have shared one paper with you that is comparative aspect of Marm Chikitsa with acupuncture. So Chinese also believe that Marm Chikitsa is a potential thing used for treatment purpose, and they have compared it with acupuncture. So it's not that people don't believe, but the problem is the stakeholders of Ayurveda themselves don't believe enough in practicing Marm Chikitsa. That's why there is a problem. But I can tell you the scenario in last 3 or 4 years, it has changed drastically, and there are a lot of studies published now. A lot of studies are being going on. People are doing MDs, PhDs on Marm Chikitsa, and I'm sure in coming 10-15 years, we'll have a volley of research on the Marm Chikitsa and we'll be able to establish it globally.
Okay, thank you so much, sir.
No, sir.
Okay, so as there are no more questions, once again, I thank you, sir, for sharing your valuable insight on Marma therapy. Your guidance will surely help our budding practitioners overcome their fear and practice Marma with confidence and efficacy. We appreciate your time and expertise, sir. Thank you, sir.
Thank you so much, ma'am. It was a pleasure talking to you all, and I'm always open to share this beautiful science with all the stakeholders of Ayurveda. And I'm very pleased that youngsters are a part of this webinar. And I think I was able to instill a little confidence in them and clear a few of the doubts. I'm available and get the benefits of it and give the benefits to the patients also. So thank you so much. Thank you, Professor Mukund Dule, sir, Principal Ma'am, and all the faculty of Sumandeep. It was a pleasure talking to you all. Thank you. Thank you.
Same here, sir. Thank you. As we come towards the close of this enlightening webinar, let us take a moment to thank all who made this event possible. On this note, I now invite Dr. Beatrice, Assistant Professor, Department of Shalyatantra, to kindly deliver the vote of thanks. A very good evening to one and all. On behalf of the Department of Shalyatantra, it is my privilege to deliver the word of thanks for today's national webinar on Marma Chikitsa. First and foremost, I express our deep sense of gratitude to our parents' institute, Sumandeep Vidyapeeth, whose vision and encouragement continue to provide us with opportunities to engage in such meaningful academic exchanges. I also extend my sincere appreciation to our respected in-charge Principal Dr. Aparna Deshpande ma'am for her constant guidance and support. With deep appreciation, I thank our distinguished speaker, Dr. Afil M. Alex and Dr. Gaurav Phul for their scholarly and insightful deliberations. Their thoughts-provoking session have not only enhanced our understanding of Marma Chikitsa, but also inspired us to explore its clinical application more deeply. I take this opportunity to acknowledge the support and presence of our faculty member and to all our participants for making this program lively and meaningful. I want to extend my thanks to the IT and technical team for their smooth coordination and support. Last but not least, I extend my heartfelt thanks to our team, the Department of Shalya Tantra, for their commitment, teamwork, and meticulous planning that ensure the success of this webinar. Once again, I thank you all.
Once again, on behalf of Sumandeep Vidyapeeth and Department of Shalya Tantra, we thank all of you for your valuable presence here. With this note, we sign off. Thank you.